What is robotic partial nephrectomy? After your diagnosis and depending upon the size of your kidney tumor, your doctor may recommend what is called partial nephrectomy or kidney removal surgery. Historically, the entire kidney has been removed when a cancerous tumor is discovered, as your body can still function with only one kidney. However, this places you at higher risk in the future for high blood pressure, heart issues, and chronic kidney disease. With robotic technology, surgeons are able to remove just the tumor and a small amount of normal kidney tissue. Partial nephrectomy has a cancer control rate of 95% and still preserves kidney function. Procedure. A robotic partial nephrectomy is performed with the surgeon controlling robotic arms that maneuver through multiple small keyhole incisions to remove the tumor. These robotic arms are like hands that can articulate in 7 different degrees of motion. The camera used during surgery magnifies tissue 10 times in 3 dimensions. With this new technology, surgeons can perform partial nephrectomy with great precision. The procedure is done at the hospital under general anesthesia, with the patient usually lying on his side. New technology lets the surgeon use a special dye called ICG to light up the kidney under fluorescent light. The kidney lights up in green, and the tumor usually lights up in a different fluorescent pattern, helping the surgeon identify and define the boundaries of the tumor. Sometimes ultrasound images are also obtained to help the surgeon outline the tumor. With the use of robotic technology, the surgeon can excise the tumor and remove a small amount of normal surrounding tissue. Once the tumor is removed, it will be placed inside a small sealed bag so no cancer cells are spilled inside the body. The surgeon will then stitch up the incisions. It is possible that at the time of surgery, the tumor will be deeper or larger than expected. This means a partial removal will not be the best solution, and a total removal of the kidney will be required during the same surgery. The robotic partial nephrectomy normally takes approximately 2 hours to complete. Risks. With kidney surgery, there is a risk of bleeding, but a blood transfusion is rarely necessary. There is also a small risk of infection at the incision site. There's a risk of urine leakage if the surgery is done in the deep part of the kidney where the urine collects. This rarely requires any further surgery. There is also a small risk of injury to surrounding organs. In rare occasions, excess bleeding or complications may lead to the open removal of the entire kidney. Alternative treatment options. Depending upon the size of the tumor, you may have options rather than surgery. One option is observation. If the tumor is very small, it may not require surgical removal. If a patient is not physically fit for surgery or wants to avoid surgery, observation with periodic X-rays can be done. Another minimally invasive option is a technique called ablation. While video frequency ablation is sometimes used, typically the treatment is done through cryoablation or by freezing the tissue. Radiologists normally perform this procedure with small probes or needles going through the skin, directed by a CT scan. These needles deliver argon gas to the tumor, freezing it. The procedure is usually performed in the X-ray department with a possible stay overnight at the hospital. The cure rate is 90%, but you will need close postoperative follow-up. Some patients, depending upon the size and the location of their tumor, are candidates for cryoablation. Prepping for the surgery. Several days before surgery, all blood thinners are stopped. Please ask your physician about specific medications to avoid. As with all surgery requiring a general anesthetic, please do not eat or drink anything after midnight the night before your procedure, and you should arrange for transportation after the procedure. Post-op and results. After surgery, you will be placed on a pain relief pump for 24 to 36 hours. Then you will start to take oral pain medication if the pain is not too severe. You will stay in the hospital for 1 to 3 days and then can return home with oral pain medication. You should not notice any difference in the amount of urine that you make when you go home. You should monitor your temperature. A low-grade fever is expected for the first few days. However, please call your doctor right away if your fever is over 102 degrees. You should also let your doctor know right away if you have blood or blood clots in your urine, if you have severe pain, or if you experience severe constipation for more than 2 to 3 days. You will be able to resume most of your normal routines. However, you should not resume vigorous exercise, drive for 2 weeks, or lift anything heavier than 20 pounds for a month after surgery. Your physician may schedule a follow-up CT scan 3 to 6 months after your surgery. Depending upon the aggressiveness of your tumor, you may be referred to a medical oncologist. In general, follow-up will continue on a regular basis for 5 years. CT scans and lab work are generally included in the follow-up plan. For many patients with kidney masses or documented kidney cancers, robotic partial nephrectomy or tumor ablation are effective and reasonable therapies. Your urologist and clinical staff will answer any of your questions and provide additional information to help you decide if these procedures are appropriate for you.